Good afternoon, everyone. We are the Group 4 and I am Jenilyn Nantes together with my group mates Eliza Jacob, Nika Tadeo, Rhea Masonese, Micaela Tolosa, Miss Angela Asis, and Miss Kimberly Ramirez. And the topic that we are going to tackle for today is all about the history or the timeline of our health medicine. So the content of our topic are as follows: the introduction, prehistoric medicine or the Stone Age, ancient medicine, Chinese medicine, Egyptian medicine, Mesopotamian medicine, Greek medicine, and lastly, the Roman medicine. So for the introduction, we have the definition of health, disease, illness, and the aim of studying the history of medicine. So we have the definition of health. So according to WHO, health is a state of complete physical, mental, and social well-being, not merely an absence of diseases or infirmity. Recently, it includes the ability to lead a socially and economically productive life. Next one, we have the definition of disease. Disease is a condition of a body or some part of our organ of the body in which its function are disrupted or deranged. Next one is we have the definition of illness. It is a subjective state of the person who feels aware or not feeling well. So we have also development study, change over long period of time. So what are the aims of studying history of medicine? So to know the change in history of medicine over 5,000 years from about 3000 BC to present day and the effect of medicine on people's health during that period to till now. So now let's jump to our first era or the prehistoric age. Prehistory refers since the beginning of the universe. In this period, there were no written evidence of medical practice. They believe that cause of death are evil spirits and anger ancestors. They don't know about the existence of medicine, just know that human beings get born. So people die due to disease, poor diet, war, and infection. So sa age po na ito, hindi po natin masasabi na accurate po yung some na evidences because wala pong written document or nagpapatunay na ganun po yung nangyari. And may apat po tayong dahilan ng pagkamatay nila, which is war, poor diet. We have also medical knowledge and belief. Study finding have to rely on the finding of archaeologists and aborigines. So, aborigines is mostly seen in Australia. Those people whose lifestyle have not changed for thousands of years by examining their beliefs and practices. We can get an insight. We also have the aboriginal beliefs and treatments. So, people follow their traditional culture belief that everyone has their own spirit inside themselves. If a person becomes ill, it is because their spirit has left them or an evil has entered their body. Medicine man who knows all about spirits and releases the spirit from body and patient is cured. People wear charms to keep evil spirits away, and buried their cut off nails and hair and their extremities, probably to prevent spirits casting spells on them. They even use herbal medicines. Prehistoric people understood that some medical problems were the result of natural causes and would treat the problems using natural remedies. Problem was believed to have supernatural causes. So gaya nga ng sabi ko kanina, ang mga tao noon pinaniniwalaan na ang isang katawan ay may isang spirit. Once na nagkasakit ka, sasabihin nila na maaaring umalis yung spirit sa katawan mo or merong evil spirit na pumunta sa katawan mo. And additionally, meron po tayong tinatawag dati noon na medicine man or yung tinatawag natin ngayon na mga manggagamot po. Sila po yung nagpapalaya and kumakausap sa mga spirits. Naniniwala po sila sa mga fake healers po. In this age rin po, people wear charms to keep evil spirits away. May mga anting-anting po silang ginagamit para daw po protection, mataboy yung evil spirits. Also po, naniniwala po yung mga tao dito na natural causes lang po yung pagkakasakit ng mga tao noon at kinakailangan lamang po ng natural remedies like yung pagre-ritual po, yung pag-aalay sa mga ano po nila, mga gods po nila dati. So we have also the surgery. Trepanning was the process in which shamans used to make a perforation in the skull to expel the demon or evil spirit. This was practiced to cure headache, epilepsy, or tumors. For trepanning, they used sharpened edges of stones and flints. So, in this age po, napakaaga na natuto po silang mag-surgery, yung binubutasan po yung ulo para maalis daw po yung headaches, epilepsy, and also tumors. That's all for my part. Thank you for listening.
Ancient period 5000 BC to 499 AD. In the ancient world, the gods were often held responsible for one's good health and making offerings to them. Reading out spells or wearing amulets was a common way to make sure illness stayed far away, but there soon developed a whole body of professionals who believed they could help where the gods could not. Health and illness were interpreted in a cosmological and anthropological perspective. And also, medicine was dominated by a magical and religious beliefs. Henry E. Sigiris, 1891 to 1957, a Swiss physician and medical historian, stated that every culture had developed a system of medicine. Dubus says that ancient medicine was the mother of sciences and played a large role in the integration of early culture. And also, he says, surveying past and present biomedical control of human life and the possibilities of improving it in the future, medicine was at the beginning. That's all my part. Thank you for listening.
Let's continue to the Chinese medicine of 2700 BC. Chinese medicine was the world's first organized body of medical knowledge. God of Chinese medicine was Shen Nong. It is based on two principles, the yin and the yang. Chinese doctor attempted to make diagnosis by studying the state of the pulse. Hygiene, hydrotherapy, massage, drugs were used by the physician. They think heart was considered place of wisdom and judgment, while liver and lungs associated with soul. Chinese were early pioneers of immunization, and they practiced variation to prevent smallpox. Chinese medicine also a great faith in traditional herbs. Chinese system of barefoot doctors and acupuncture as well known throughout the world. In ancient Chinese medicine, their average lifespan is up to 20 to 30 years. And in Chinese medicine, they base in the herbs. In Chinese medicine, they believe in yin-yang concept, the balance concept of health. The yin is the positive force and the yang is the negative force. The imbalance between these two life force is called disease. Life force is called qi, circulates through meridians, energy path. Disturbance to the flow of these energy forces will cause blockage of meridians and cause disease. To remove obstruction and correct the flow of qi in meridians, the acupuncture produced has been advised by the Chinese physician. And in this time of period, they began to search medical reason for it. So Chinese medicine use treatments like herbs, hydrotherapy, acupuncture, massage, moxibustion, and etc. And the acupuncture is still alive to this year. They use it as a relief of pain. And up until now, they being practiced. So that's all for Chinese medicine.
Roman medicine 130 AD. By the 1st century BC, the center of civilization shifted to Rome, brought their medicine from Greek and were more practical-minded than Greek. Nican sanitation. Public health was born in Rome with development of baths, sewer, and aqueducts. Rome redefined roads, brought pure water, drained marshes to combat malaria, built sewer system, and established hospital for sick people. Roman medicine was greatly influenced by earlier Greek medicine and literature but would also make its own unique contribution to the history of medicine through the work of such famous experts as Galen and Celsus. While there were professional doctors attached to the Roman army, for the rest of the population medicine remained a private affair. Nevertheless, many large Roman households had their own medical specialists among their staff, and with the spread of literature on the topic, the access to medical knowledge became ever wider. Treatments became more well-known, and surgery became more sophisticated. Roman. Galen was Rome's medical teacher and was physician to Roman emperor. He stated that health precedes disease, so we should be concerned how health may be preserved and how one may best cure disease. His name was Claudius Galenus, often referred to as Galen. Although Greek, Galen was born in 129 CE in the Roman ancient Greek city of Pergamum. In his lifetime, Galen would become the most influential and esteemed physician and medical researcher in the Roman Empire. Galen went to Rome in 162 and made his mark as a practicing physician. His public demonstration and impatience with alternative views on medicine brought him into conflict with other doctors practicing in the city.
Egyptian medicine 2000 BC. Medicine in ancient Egypt incorporated both conventional regional medicine and religious practices. Religion played a major role in ancient Egypt daily life. There was an overlap between the priesthood and healers in addition to the employment of incastation, amulets, and imagery related to deities such as Horus and Seth. The Egyptians' religious life induced health shaped their understanding of the human body, how it functioned, and how to heal it. Egypt is the one of the oldest civilizations documented from the beginnings of the civilization in the late 4th millennium BC until the Persian invasion of 525 BC. Egyptian medical practice when largely uncharged and included simple non-invasive surgery settings of bones, dentistry, and an intensive set of Pharmacopoeia, Egyptian medical through influence later tradition including the Greeks. Invented pictures, writing, and record their own papyrus. Evil gods and demons were responsible for diseases. People were amulet to warn of evil. Until the 19th century, of main sources of information about the ancient Egyptian medicine were writings from letters in antiquity. The Greek historian Herodotus visited Egypt around 440 BC and wrote extensively of his observation of their medical practices. In 1822, the translation of Rosetta Stone finally allowed the translation of ancient Egyptian hieroglyphic and inscription and papyri, including many related to medical matters. Priest was the one who used to treat the illness at ancient period. Temple were used a place of worship, medical school, and hospital. Mummification of body leads of increases understanding of anatomy to diseases. Was one of the first physicians and also did oral surgery for the first time. They believed that diseases was due to the absorption from the intestine of harmful substance, putrefaction of bloods, and formation of pulse. They believed pulse, the speed of the heart. Disease was treated with enema, blood-letting, wide range of drugs. Best medical manuscript belong during Egypt time are Edwin Smith Papyrus 3000 to 2500 BC and Eber's Papyrus 1550 BC. First is Edwin Smith Papyrus. He is the oldest treatise on surgery, dating from the 70th century BC. The Edwin Smith Papyrus is a unique treatise containing the oldest known description of a sign and symptoms of injury of the spinal column and spinal cord. Based on the recent, medically based translation from the Smith Papyrus, it's enclosed treasures in diagnostic, prognostic, and therapeutic reasoning and vivisection. Although patient demographics, diagnose techniques, option charge over time, the documented regional on spinal injuries can still be regarded as the start of the art reasoning of modern clinical practice. Second is Eber's Papyrus was found with the mummy on the banks of the Nile. The Eber's Papyrus, also known as Papyrus Ebers, is an Egyptian medical papyrus of herbal known age dating to 1550 BCE. The late second immediately period of early New Kingdom. Among the oldest and the most important medical papyri of ancient Egypt, it was purchased at Luxor in the winter of 1873 to 1874 by the German Egyptologist George Ebers. It gives information, mainly medical, includes virus diseases, drugs descriptions. It's covered disease of abdomen, eyes, skin, cough, treatments, and this herbal medicine and animals remedies. Diseases are reported in papyri are worms, eye disease, diabetes, polio, and represent in modern Egypt. They had also some knowledge against smallpox, benefit of mosquito net, and associated. That's all my part. This is Rhea Maysinese.
Greek medicine 1500 BC. Greek made a distinction between therapeutic medicine and preventive medicine. People believe on demons and deities. In the past, it consists of prayer and sacrifices. The early leader of Greek medicine was Asclepius, 1200 BC. Asclepius' two daughters, Hygeia and Panacea. Hygeia is a goddess of health, cleanliness, and hygiene. Her name is the source of the word hygiene. Hygeia is the one of the daughter of Asclepius, a chef of attendant to her father. She was more directly associated with the cleanliness to how to live long life and prevention of sickness. Panacea was the goddess of cure, and panaceas in the form of medicine, salves, and other curatives. Panacea is a Greek mythology. Panacea is a goddess of universal remedy, was the daughter of Asclepius. Panacea and her first sister is performed of phases of Apollo's art. Hippocrates, 460 to 370 BC. Father of medicine, he studied and classified disease based on observation and reasoning. He studied about the effect of various environment, factors like air, water, and etc. of human health. Hippocrates, known for abstract. Hippocrates is considered to be the father of modern medicine because in his books, which are more than 70, he described in scientific manner many diseases and their treatment after detailed observation. He lived about 2,400 years ago. So, what did they call Hippocrates? For this is widely known as the father of medicine. Approximately 60 medical documents associated with his name, including the famous Hippocratic Oath, have survived to this day. The document Wilde eventually gathered into the collection known as the Hippocratic Corpus. So, what is Hippocratic Oath? The Hippocratic Oath is perhaps the most widely known of Greek medical texts. It requires a new physician to swear upon the number of healing gods that he will uphold a number of professional ethical standards. That is Hippocratic Oath.
In ancient Mesopotamia, the gods informed every aspect of daily life, including the practice of medicine. Gula, the Sumerian goddess of healing, presided over the medical arts, guiding doctors and dentists in the treatment of health problems, usually attributed to supernatural causes, for over 2,000 years. Many aspects of medicine later associated with Greece were pioneered in Mesopotamia. Gula, also known as Ninkarak and Ninisina, was not solely responsible for health and healing, however, but was assisted by her family, including her consort Pabilsag, also a divine judge. Her sons Damu and Ninazu and daughter Gonora, the rod intertwined with serpents, which today is the insignia of the medical profession, originated with her son Ninazu, who was associated with serpents, transformation, the underworld, and healing. Physicians in Mesopotamia were simply the agents through which such deities worked to maintain the health of the people and would be described today as general practitioners, specialists, surgeons, dentists, faith healers, and therapists. The doctor, by whatever name, was among the most highly educated professions in Mesopotamia and was always referenced with great respect. A doctor had to first study to become a scribe, then focus on medical treatises, and finally concentrate on their specialization. Learning cuneiform script and mastering the curriculum of the scribal school took 10 to 12 years at least before one could devote oneself wholly to the study of medicine. Once recognized as a doctor, however, Mesopotamian physicians generally lived very comfortable lives.